Alors, bonjour et bienvenue à cette...
So hello and welcome to this press conference of the Minister of Health, Mr. Christian Dubé, the National Director of Public Health, Dr. Horacio Arruda, and the Director of the COVID-19 vaccination campaign, Daniel Paris. So hello everyone. First, I would like to mention something about the epidemiological situation before going on to the present subject of the vaccination campaign. So I would say despite the fact that the epidemiological situation of Quebec is stable, there are regions that are right now under pressure. Right now, we have transmission that is very significant and increasing in the lower St. Lawrence, particularly what we call the greater Rivière-du-Loup area. So we have to intervene immediately before it gets worse. So I'm announcing to you that as of the night of Saturday to Sunday, special emergency measures will be applied in the lower St. Lawrence region with the exception of Matane, Matapédia, and Métis, those municipalities. But I wish to specify that primary schools will remain opened in the entire territory. I think it is important that we have to continue containing the contagion of the virus and the variants, and that is why we have decided to listen to, once again, the recommendations of public health and make a decision very quickly. Now, we are going to go to good news because today is a great day with this. We talked among ourselves, knowing are we going to talk about the car, the light at the end of the tunnel? No, we decided that the sky is starting to get sunny and we really are starting to see the sun's rays. And I think that we're all been expecting this day for a long time. It's a great day for Quebec. In the last weeks, the last months, we've put everything in place and we have prepared our network for the opening of the vaccination campaign for the general population, which we call mass vaccination. We've prepared vaccination clinics. We have put pharmacists who are going to help us out, as well as Quebec's business community. And just in the past week, over 1,000 vaccinators have added who presented themselves through Je Contribue for a total now of 12,000 people. We can say it, the vaccination campaign up until now has been a success, and I wish to take advantage of it today to thank all the staff from the Health Network for all the efforts that they've deployed over the past few months. I am therefore happy to be able to announce today that we are going to open up vaccination to the general population, to the general public. We know that Quebecers have been very patient, very, very patient, and we recognize the efforts that they've deployed. So I'm announcing that in 2 weeks' time, the entire adult population will be able to make an appointment to get vaccinated. As of tomorrow, people 50 to 59 years of age will be able to make an appointment on Clic Santé. Afterward, we'll go by age group. Every 2 days, we'll go lower by 5 years. And that's very important. It will be done once again following age groups and the age of the people, not the year of birth, but the age of the person. So next week, as of the 3rd of May, it's the 45 to 49. The 5th of May, 40 to 44, and so forth. The 7th of May, 35 to 39 years of age, and the following week, what people in my cabinet call the Week of Youth, the 30 to 34, as of the 10th of May, 25 to 29 on the 12th of May, and finally the 18 to 24 age group on the 14th of May. Those are the following 2 weeks. With the deliveries of vaccines that we're receiving right now and which we'll receive in May and June, and thanks to the enhancement of the 5R zones, we will be able to give a first dose to all adult Quebecers who wish to by the 24th of June. We've said it, we don't want this increase to just be on the shoulders of our network, the increase in work, and that is it's so important to have set up this vaccination system. Therefore, to increase the speed at which people get vaccinated as of next week, 10 companies will already be in action as of next Monday to vaccinate their employees, their families, and the area's public. Pharmacists will also receive more doses as of next week. Now, There is no doubt left we will reach our objective of the 24th of June. Now, I want to come back to those who were targeted by specific announcements in the past few weeks. I also want to take advantage of this to remind people with a disability, people who have chronic diseases, and pregnant women that it's still time to make an appointment before we open up tomorrow morning to people 50 to 59 years of age. We've had an excellent vaccination rate in the past week for specific categories, and I think that it is important to recognize them and to respect them up until today. So they'll be able to continue doing so, but they have a preference until tomorrow. To conclude with, just very quickly, there's a fight that we have to finish off between the vaccination and the virus. To win this battle, Quebecers have to continue being there to get vaccinated. On our own end, we are vaccinating. And if we keep the virus under control, all of us together, victory is within our reach. Thank you very much. I remain here to answer questions. We were talking about a lack in certain sectors. So with the 12,000 vaccinators, do we have enough staff? But you still had to make a call out to the public. I have to tell you, it's so important for us to do the training in order to be able to continue having people to take over. I think that we'll take anybody who wants to register still, because I'm repeating it, once we get to May, and particularly in June, and if we're thinking about the second dose that is also going to be spread out over the summer, I think we'll never have too many people to come and help us. So particularly if there are students who would be interested in coming to help us out, we're still open, and it would give us the time at the beginning of May to be able to train them. Concerning the age categories and the available vaccination, Mr. Arruda or Mr. Dubé, could we have an idea? AstraZeneca, is it still going to be blocked at 45, or are we going to lower it like the federal government, who has recommended until 30? And the Johnson & Johnson, who is it going to be for? Can we have an idea? I'll let Dr. Arruda answer. Well, I think that for Quebec, for the time being, following our epidemiology, we don't have the intention of going below 45 years of age for AstraZeneca. As far as Johnson & Johnson is concerned, we're waiting for the National Institute of Public Health, but I think it'll be the same thing, that is that we won't give it to people below 45 years of age. So the other two vaccines will be left that will be able to be used for the other clientele, and under certain particular conditions for people very immunosuppressed, we'll give them certain kinds of vaccinations, or vaccines. But that is what we're planning on right now. As far as the second dose is concerned, since the doses are there, particularly Pfizer, can we consider giving the second dose more quickly, taking into account that the 4 months is the maximum delay? Could it be done more quickly? Well, I'd like to say that first, our commitment, and Daniel can complete, the commitment for us was really for CHSLDs, and after that, RPAs, as you know, in the same order that we had to respect the first dose. Now, we also have to take into account what can be done in hospital centers. So the same sequencing that we've had, with healthcare workers, generally speaking, that is what we'll be following for the second dose. The only thing that we might decide to do, depending on how other vaccines, for example, Moderna, if we get more, then we could perhaps accelerate things. But we can, at the very least, respect our commitment. But it could perhaps go more quickly. But for the time being, I'd like for us to concentrate on finishing up with the first dose. Thank you. And I'd like to continue. It's already over 70,000 for the second dose that were administered as of last evening. So, we're following our calendar. And in link with the arrivals of vaccines, as I mentioned, Pfizer is there. We've had confirmation yesterday that Moderna is also going to continue with its deliveries in the week of the 10th of May. There's over 238,000 doses that are expected. It's all good news for us, and we're following the calendar, we're following our pace. Primary schools remain open in the Lower St. Lawrence. The contagion does not seem to be from the schools. Is it possible to know where the contagion is right now? What is the most worrying? Well, there can always be outbreaks in schools, but we know that they're small and we can contain them very quickly by intervening. There seems to be a certain level of community transmission in work areas and with gatherings. And what is happening right now, we're not in the same situation that we experienced in Quebec with an exponential increase, but we are in a very significant quantity of cases, and they're not lowering, they're actually increasing. As the Director of Public Health was saying, it's like a tide that's going up. It really is like that, like a tide going in. And to avoid us ending up in situations where there would be significant impacts in terms of services, etc., I think that we have to act quickly now rather than later. And we can allow ourselves, however, adequately to maintain the primary schools open, because we're able to do the necessary interventions. In the primary school, it's a lot more difficult to do remote learning, and these are territories that are not very well covered by internet as well. So I think that the effort and benefits aren't there. But, working environments and people gathering, I think that is one thing that we have to be able to control.
Louis Lacroix, Cogeco.
Bonjour, Monsieur le Ministre, Dr. Arruda, Monsieur Paré. My
question, first question for Mr. Arruda. You had mentioned a week or two ago that you were studying the interchangeability of the doses for people who received AstraZeneca. Where are you at with that thought process? For example, if the second dose we didn't have AstraZeneca, might we go with an ARN vaccination rather than viral charge or viral load? I would say that there's a meeting of the Immunization Committee that is studying right now. Right now, the information that I've had, the president of the SIC is that right now the recommendation is to give the same kind of vaccine, AstraZeneca together with AstraZeneca, etc. However, there are studies that are being made right now, and theoretically, the interchangeability is something that could be done, and there might even be certain benefits. But before saying anything further, I prefer having good evidence. But it is being studied. My other question is, you said something about the vaccination passport. I'm not surprised to hear about that. I'm very predictable, aren't I? And Mr. Dubé, you said, or you referred to what you called last week, hold on, I'm looking for the right term, evidence, digital vaccination evidence. So France has presented this week a bill, they call it an exit crisis bill, and they don't much like the idea of the vaccination passport, except that Article 1 of that bill says that predict that can be imposed to any person coming in or out of the national territory the presentation of a negative test, a certification of vaccination, or a certification of reestablishment from COVID-19, or recovery, from COVID-19. Is that the kind of thing that you are exploring? Well, as I said, and I'm going to repeat it again, I asked to have digital evidence as quickly as possible to replace the paper evidence that we have. For those who haven't been vaccinated or those who have, you right now, when you leave the vaccination center, you have like a little piece of paper with the date of your next appointment on it. We said that we wanted to digitize that. I always said that I wanted us to have a QR code as quickly as possible, something that you could have on your phone that you could get by email. That is the first step. And I think I said it yesterday. I'm like losing track of the days. I'm meeting Ms. Savoie and her team for a presentation tomorrow, so tomorrow, Friday. So I'll be able to tell you a lot more after. But once we have that digital evidence, what we've asked Dr. Arruda and his team is to go into the details of what are the ethical questions, under what situation could these be used, So France is a little bit further along than we are. I think that my first objective, our first objective, is to have the technological evidence. But what would it be used for? I mean, if I understand Mr. Arruda's reservations yesterday, but if we have that vaccination evidence, what would it be used to? What would be the purpose of having a QR code? Well, we got a very good question at the Crédit yesterday. I think it came from Gabriel Nadeau-Dubois, who was speaking about that, and I think that he's doing a follow-up on your questions. And we said, listen, we already need a vaccination evidence when we go to certain European or African countries. We already have to show that we've received certain kinds of vaccines. So I think that today it's a little bit too early to know exactly what this will be applicable to. But I think that every time that we need proof of and evidence of vaccination, which was the case way before the pandemic, well, we have to give ourselves modern tools, and that's what we're looking at. But the global application of it will follow the recommendations of public health, and that will be done by experts. So it would be more for traveling than for activities? We'll get back to you with a recommendation. Concerning the target of 75%, I'd like to have a few details. First, why specifically that target? Why was that the number chosen? And second, why is that the same in all age groups? Because we know that the risks are not the same in all age groups. And if there's more than 75% of people that want a vaccination, do we have enough? The answer is yes. If more than 75% of people want to get vaccinated, we have enough. That's why the Premier was very clear. We've given ourselves a target. We had to have a target. It was calculated in the following way. We took the total population. We removed the 0 to 18 age category who are not in the initial phase. We got to a number. That number times 75% became our target for the first dose of 5.3 million people. That is the way that we got to that number. But as we can see, in most categories, and I think that we have already put it on the website, I don't know if it was yesterday or the day before, we can see that in the categories of 80 and over already at 91%, for example. And every time we put in the new age categories, every time we've gone over 75%. So I hope that we'll continue getting that good news. But if we go beyond our target of 75%, I think that the first person who will be happy about that is Dr. Arruda, because what he wants is that we vaccinate as many people as possible. Yesterday, Dr. Arruda, during the study of Crédit, you opened the door to vaccination of teenagers. I understand that you're still waiting to have the results of the studies that are ongoing. But is it to be understood that there's already a structured plan in place that is ready to be acted upon if there's good evidence? Well, vaccination in schools has been done for years. For hepatitis B, for example, for the human papillomavirus, and it's clear that we already have discussions with the Department of Education to know how we could even, in the summer, get to vaccinate if it was indicated to protect as many people as possible. So based on the plans that we usually have, we'll be able to do so with adjustments, having to do with the processes. Mr. Dubé, you said there's no longer any doubt on the objective of the 24th of June. Does that mean that you had doubts? Well, I've never had any. Danielle, had you ever had any doubts? No? No. Well, listen, we've always said it. We depend on the number of vaccines that we get. But I've been saying, with the quality of the delivery that we've had from Pfizer since the adjustment in the month of January, their production, which was adjusted to last to be able to deliver more vaccines, I think that we really can base ourselves on that. They deliver very regularly. It allows us to really planify things well. So we see no reasons right now to doubt of their ability in delivering to us. Mr. Perret, I'd like to hear you on, don't necessarily want to say phenomena, but the fact that there are people who go get vaccinated in other regions, not just 2 or 3 people. I think we already know some. Does that change the distribution, because if a lot of people from Quebec City, for example, get vaccinated in Trois-Rivières, that means that we need more in Trois-Rivières. Well, we can follow it, particularly in the greater metropolitan area. We know that when we opened the priority groups for professors and CPEs, we saw people who lived in Laval, for example, but who worked in Montreal or vice versa. So now we can follow each of the regions in each of the different categories, and we give ourselves some leverage to compensate to make sure that the coverage is at the same level everywhere in Quebec. And proportionally? Well, no, because as I said, we adjust them regularly. We see more that phenomenon in the regions outside. For in Quebec, it's Lévis. But the phenomenon is on both sides. There are people who live on one side and live on the other. So we haven't felt great differences, except for the Montreal area. And as I said, we compensate them to follow the vaccination coverage in adjacent or adjoining places. You have a very specific plan with dates, and it's out of any doubt that we'll get to your objective by the 24th of June. And we can also see the effect of the vaccination coverage in Quebec increasing every day. Are you going to also file a plan for the end of the lockdown linked to the vaccination coverage, or there's no link to be made between the two? Well, listen, I think that we have already addressed that question. We really look forward to being able to talk about ending the lockdown. I don't just want to reassure you, but reassure all Quebecers that we also look forward to the end of the lockdown. But I think it's a little premature to be finalizing that now, because look at what is happening in the lower St. Lawrence region. We still have situations of variants, and that can sometimes affect our plans. So for me, it's quite clear that those discussions are ongoing. I think that we will have a few presentations this weekend. So we'll try to talk about it over the next few weeks, but it's clear that as we vaccinate, Mr. de Cavalier, we are becoming more and more certain to be able to present a plan, but it's too early to do so. The vaccine can still play a few tricks on us. The 75% target was established before the new variants arrived in Quebec. The fact that the new variants are more transmissible, does that make it that percentage to have good and appropriate coverage? Will it have to be higher? It's a possibility, but we also have to see that in that 75%, we've excluded young or people who could not be vaccinated, first of all, and we give ourselves targets. We always know that 100% vaccination coverage in all age groups is just not reachable. So we've given ourselves that first objective quickly, and it was also with the perspective where we wanted to give particularly a first dose to a maximum of people as possible. So I think that it really is the epidemiological situation and the knowledge that we're going to get more and more, and how we see the outbreaks and the contagion in different territories, that's going to help us. But to go back to the question that you asked previously, just to say, we can't think that there's one magical number to find, 75 or whatever. It'll be a series of factors because there's so many unknowns, things that we have no control over. It really be on the basis of epidemiology, the vaccination coverage, the observation of where are the places where there are outbreaks, age groups, and that will always make us adjust our strategy. And that is why we asked public health to look as well. The end of lockdown is one thing, but how can we do it? How can we play with the measures? What are we going to do with working from home? What will be the conditions of working from home? What will be the conditions of wearing a mask? There's many of these things that we have to set up to be able to say, here is a game plan. This is how it's going to be done. So that's why there's a lot of questions. And I think that the best news that we have right now is to have stability in the cases. And I think that this is very good news. And we saw what happened over the past few days. It's been 4 or 5 days that we have significant decreases in the number of hospitalizations. Remember that that was one of the important elements. So knock on wood. Because up until now, it's getting confirmed, decrease in cases, in hospitalizations. But we have to remain prudent because the fire is still on. There's still 1,000 new cases per day. So that's why we have to be prudent. And the plan that you're talking about, we are working on it, but I think that we have to stay prudent for a while yet. And since we're now at the other part of the press conference, I'm going to start with the written questions. I just have a clarification that I'd like to bring. I see in my note that I made an error. I talked about Saturday night for the Lower St. Lawrence. No, it's the night of Friday to Saturday. I thought it was Saturday, but no. The measures, the emergency measures in the Lower St. Lawrence are as of Friday, as of tomorrow. I apologize, but I want to correct it right away. No problem. So written question. Respectively, how many doses of Pfizer, Moderna, AstraZeneca, and Johnson & Johnson will Quebec receive in the predictable future? Danielle, in the month of May, perhaps the best idea would be to give the month of May. I was going to give you an answer and just say a lot, but I think you want to be more specific. No, more seriously, we're talking here about the deliveries. Pfizer is 450,000 every week. Johnson & Johnson, the only confirmation that we had from the federal government is 67,000 doses for next week. And for Moderna, we have an arrival today and tomorrow, 130,000 doses. And we had a confirmation in the week of the 10th of May of 230,000 doses of Moderna. But for Moderna, it's always confirmed more or less from one week to the next. So we also expect to get more deliveries over the following weeks. And was AstraZeneca in the list? AstraZeneca, we have no predictability for the time being. Now, the second question, what is your plan, if there is one, for the 24-hour vaccination? Will the curfew not cause problems in relation to this? When you say 24 hours, I mean 24 hours a day. Danielle? Well, one of the points that we mentioned earlier on, in vaccination, we need people to vaccinate. I think that we've talked about that. We need vaccines, and we also need people who decide to come get vaccinated. And once we get to our younger groups, we're probably going to give different accessibility. We talked about it last week, vaccination, drive-in vaccination. But we also want to lengthen our vaccination hours. But once again, I think that in a curfew, getting a vaccination is a good reason to be out during a curfew, if that's what it takes to be able to reach our clientele of every age. And maybe also mention that as we vaccinate more and more workers and young people, we'll adjust our schedules as well. We're going to have more evening appointments. Yes, with younger people who are often working, we're going to make sure, together with all the CIS and the CIUS, to have either lengthened vaccination hours or also vaccination over the weekend. So we'll make sure with them over the upcoming weeks that there will be an increase in the offering of appointments for the public. I call that in unfavorable moments, but that are more accessible for people in the labor market, because our objective is that the accessibility do not be an impediment to getting a vaccine. For the 45 to 55 age group, will it be possible to refuse the AstraZeneca vaccine? We made the choice in Quebec to really make the vaccination process with Astra vaccination very transparent. When you go on the Clic Santé site, it's very clear for everyone. You choose. If it's not written that it's AstraZeneca, it means that it's not AstraZeneca. It's one of the other ones that are offered. Mr. Dubé, you had said that you were disappointed by the lower response from the vulnerable clientele. You said that it has improved. To what extent has it improved, and how much did it play to actually, the fact that these populations are not so quick? How much did that play to go at the population at large? Well, no, it didn't play a role. Danielle and I were looking over the past few hours yesterday and up until a few minutes ago. Over 750,000 appointments were taken over the past week. We have days where we had over 200,000 people who booked an appointment. So if you calculate the public that we targeted, remember what we had counted, I think that we went and got a very large part of the public that we wanted to get appointments from. Of course, we wanted to be accommodated by adding the close caregivers and by adding the parents, for example, for people with disability. Of people, there are people who take advantage of that, and so there's more appointments given. But we are so close to the general public that we thought that it was the right choice to do. So no, on the contrary, I would say that the reason why we can accelerate is because we have had a confirmation of the vaccines that we're getting. And so now we can say we gave the priority to the vulnerable clientele. It was a choice to make. And I give them up until tomorrow. They'll be able to continue doing so, but up until tomorrow, they have priority. And we even said, because it was a request that we had received very often, to be able to add two parents, because in the case of people with a disability, very often it's both parents who are at home. And so we didn't want to, like in the case of close caregivers, limit it to one person. So we thought we're so close to the general public that we granted up to two parents that can get vaccinated at the same time as the people with a disability. What about pregnant women? Pregnant women are the ones that were added this week. So I think that it also allows those people to have access. Before we go to more populational, and just yesterday, it's over 125,000 appointments that were taken on the Clic Santé system. So we can see that the attraction for the vaccine is still there. Concerning the situation in Abitibi-Témiscamingue, the situation is relatively stable and has been for many days. The region has no new cases and only 23 active cases. What will it take to go to yellow? Well, these are discussions that we have with the Director of Public Health. As you know, the situation can vary very significantly, very quickly, and sometimes as well, when we lower things too quickly, it passes a signal and there's an increase. So these are discussions that we will have to maintain stability, etc., and the analysis as well of positivity rates, as well as if there's a risk of the new variants. But it's being talked about. No worries. We want for regions that are doing well, that are performing well, to be rewarded. That's clear in our mind. A clarification on something that was said at the press conference on Tuesday, because it made me question things. Mr. Legault said that as of the 3rd of May in Montreal and in Laval, the curfew was going to go from 8 p.m. to 9 p.m., 9:30 p.m. But in the Quebec region, where there's the special measures, it's at 8 p.m., and those conditions are supposed to be up until the 3rd of May. Does that mean that we're going to continue having a curfew up until 8 p.m. as a 3rd, or is it going to also be increased to 9:30, taking into account the fact that since we are in specific measures in the Quebec region, that is what lowered the curfew? Well, we are going to be following the epidemiological situation as such to be able to have the answer. If it continues improving, there might be a decision to come back to what we call red and no longer emergency measures. But, are we going to continue the emergency measures because there's an increase? All of that will be reevaluated. Well, yes, I know, but as I was saying, in the case of COVID-19, we've already seen, in the national capital area, the effects, and I'm not predicting anything. I don't want to look like somebody who is giving a lot of bad news all the time, but things seem to be improving, and I think that if we come back to what we'll call the red color, and no longer in emergency measures, well, right now the reds have curfews at 9:30 p.m., like the Laurentians and Lanaudière. We had done a special thing for Montreal and Laval, who had gone down to 8. And anyway, with all logic, that is what we should do. Inaudible question. To be very clear, The change that was announced by the Premier on Tuesday is only for Montreal. We have meetings every day, as you know, and that of Sunday is at 4 p.m., I believe, in the afternoon, so we'll look at the numbers then. It's just that Mr. Arruda said logically that's what should happen. Well, listen, what I would say for the time being, if there's no decision made, we take it on a day-by-day basis, and that's what we want for, we'll get there. But you're pretty good, you're pretty good. I have to say it. Yeah, I let it go, but I saw that. You're not there to protect us, that's okay. It's not my fault, you know. Yeah, we're learning. We're now at the teleconference questions. Madame Crête, can you hear us?
Oui. Vous m'entendez bien?
Oui.
Bonjour. Je voulais savoir.
I wanted to know, as far as the second dose is concerned, for people who are immunosuppressed, there are studies that show that it has the best effect when the protocol, the manufacturer's protocol, is respected. So why are you persisting in delaying the second dose for that category of people who are immunosuppressed? I don't think that we're persisting. I would say that right now, for those clients, a second dose is going to be given in a shorter period, potentially 4 weeks, for those clients. We know that already very often at a first dose they don't respond as well. It's possible that even with the second dose the response won't be optimal, but taking into account that they don't answer to this first dose as much, there will be an adjustment as far as the second dose is concerned. Now, what about the second dose for all Quebecers, adult Quebecers who want to get vaccinated? You think that we'll have, when do you think we'll be done with that vaccination campaign? Well, listen, I'm going to start with the general answer. My first objective is for the 24th of June, 500,000 that you see in our summary report, the daily report that is specific to the second dose. Now, as far as the rest of the public is concerned, taking into account that we'll have enough doses in the month of May and June, depending on how the response to reach our 75% in the categories is concerned, we'll be able to play more quickly on the second dose, but that is how Danielle explains it to me. But to make a firm commitment of dates for the second dose, the only commitment that we're taking is to respect, that we do it as quickly as possible. Well, if I could add as well, the game plan, is going to be directly linked to the confirmation of doses from the federal government. Right now, what we are given in terms of information is that it's until the 30th of June. So that is why we could commit ourselves for the 24th of June with confirmations that we've had. We're always given very large numbers where we're talking about, Q3. Well, Q3 is July, August, September. So once we have more confirmations over the next few weeks, we'll be able to clear things up as far as the game plan is concerned. But do recall that we have set up a vaccination team that is ready to do a lot of volume. And that was our basic premise since the beginning. So if we have the vaccinations, well, the vaccinator teams are there, and we will accelerate the second dose, because you'll recall that as far as the dose interval is concerned, it was to make sure to vaccinate as many Quebecers as possible to have better vaccination coverage. We've talked about it for a while now, but as far as the second dose is concerned, it's if the confirmation of vaccination dose are there, well, we'll keep going.
Oui, bonjour à vous trois. Vous m'entendez bien?
Hello to all three of you. I would like to know, unless I'm mistaken, the vaccine could be administered to the 16 and 17-year-olds. Why don't we see those people in the schedule until the 14th of May? Because we added a category recently where we're talking for people with a physical or intellectual disability. That's what we're here for right now, but unless Dr. Arruda wants to say something specific on that, but you say that you can't see it on the site. Is that what your comment is? Well, it's finished on the 14th of May with 18 to 24, so I was wondering why it's not open to people 16 and 17. It has to be understood that for chronic diseases, we consider that 16 and over was the case because the risk of complication is significant. However, as far as the general campaign is concerned, probably those students are also going to be reached through the school system. It's an approach that is going to allow for better control of what is happening. It's within that perspective that we've gone up to 18. Since we're considering an intervention in a school setting, that's where they could be reached. I here perhaps want to bring a corrective element because, sometimes we forget where we're at. When we announced the emergency measures that were being prolonged in Quebec, it was until the 10th of May. Originally it was the 3rd, and then we added a week, but we left the schools open. So I just want to say, I don't want people to think that the emergency measures in Quebec end on the 3rd. They end on the 10th, according to the last announcement. You were talking about the 3rd, and it confused me a little bit. So the emergency measures are prolonged until the 10th, or had been, a week, an extra week, but the schools are going to be open, primary schools. Thank you. Two questions that I'd like to put together. We have received in Canada Johnson & Johnson today. There's about 60,000 doses in Quebec. What will be the use of those doses? And I would also like to hear, Mr. Paré, on the drive-in vaccination campaign. You talked to us about a project like that last week? For the first part of the answer, Johnson & Johnson, I think Dr. Arruda answered earlier on, we are waiting for the recommendations of the Quebec Immunization Committee. They're meeting today. I have this, that's the information that I have, so I'm going to wait for their conclusions tomorrow for the use of the vaccine, and then we'll adopt our strategy as far as the recommendations are concerned. And for the drive-in vaccination, yes, we're also excited. It's in preparation, and I think that next week there will be more information about this. But it goes very well, once again, with our will of being able to reach different groups in different ways to be able to the best vaccination coverage possible. So that clinic will be in Montreal? Well, I can say that it'll be in the metropolitan area. Very well. We are now going to go to English questions.
Vidéoconférence de Raquel Fletcher, parce que nous sommes déjà en mode vidéo. Madame Fletcher, vous m'entendez?
Oui. You guys can hear me okay?
Yes.
I guess my first question will just be the most simple question. If you could tell our English viewers what you are announcing today, and why you have decided to proceed with 2 days between each age category.
Okay, first, just to confirm that unfortunately, with the way there was some progression of on Bas-Saint-Laurent, we announced that they will have special measures, i.e. On all the region of Bas-Saint-Laurent, to the exception of the eastern part of Matane, Matisse, and I forget the third one, if somebody can help me. Metapédia. Merci beaucoup, thank you. So unfortunately, we will move in those regions as of Friday night under the restriction. The special measure, the same that have been applied to Quebec City and Chaudière-Appalaches, to the exception of primary school. The primary school would stay open during that period. That's the first news. On the good news side, we have announced that we are opening tomorrow the vaccination for the population in general. As of tomorrow morning, 8 o'clock, people will be able to book their vaccination over the web. Starting tomorrow at 8 will be for the first category by age, starting from 50 years old to 59. That's as of tomorrow. On Monday, Wednesday, and next Friday, we move to the category of 40 years old, 45, 40, and 35 under those 3 dates. And what we call the Week of the Youth will be in the following youth. So by May 14, all the population, all the adult population would have been able to take their appointment under those circumstances. The reason we have selected this 2 days delay by each category is to make sure that people can have access, a privileged access for 2 days, to make sure that we respect the category by age as has been recommended by public health. So we're very pleased with that, and the main reason we are able to do that today is that we have respected the special category of category 8 and 9 of handicapped and essential services, as we had committed. Over 750,000 appointments have been taken in the last week. So we are confident now that we can move to the population in general, because we have also the vaccine, as Monsieur Paré has explained in the last few minutes.
Thank you. My second question is for both you, Mr. Dubé, as well as Dr. Arruda. I wanted to ask a personal question of how you're feeling today, being able to announce this, because as you started the press conference off with the bad news about Bas-Saint-Laurent, where there are these hotspot regions in the province where we're essentially under complete lockdown, and it's been a long year and some months, and then today you can also at the same time finally announce that vaccination is going to be open to everyone. How are you feeling personally? This must be very emotional for you.
Well, it is. I need to tell you that it's a bit unfortunate that we have that part to do at the beginning, but that's, I mean, this is this crisis that we have been over the last year. Is sometimes we have good news and sometimes we have bad news. For people of Bas-Saint-Laurent, we're dealing still with numbers of cases that are not at the Montreal level, the Quebec level, but they are important for those regions. So I think people understand with all the experience that we have in the last 13 months, that we need to be agile and act quickly. So that's the reason, even though today was a day of good news, we need to be active on those things. Now, if I put that aside, I will ask my colleague to say, oh, Dr. Arruda was pleased to go to general population. I will leave him the pleasure to give his state of mind today.
I can tell you that having not enough vaccine was a nightmare to make choices between groups, and we wanted to vaccinate. Now we can say I've got a dream, and the dream is coming true. So really that's the feeling I have today, and I hope that the population is going to be there, because vaccine is the way to get away from that terrible disease.
Nous en sommes maintenant à Max Griot de CTV.
C'est Matt, mais c'est correct.
Oh, Matt, excuse-moi. Matt.
How confident are you that the vaccination machine, the system, will hold up and will deliver what needs to be delivered?
I'm not calling it a machine. You are. It's, to me, that comparison with the machine. But no, seriously, I think Daniel Paré and his team, and I would like to take this question to really to thank what people have done in the system. I think Quebecers, and I would have liked to say that in French, and you make me think about it. You know, I think people have realized, Quebecers have realized in the last few months that they are taking pride of what happened in the system, what happened with our public health, what happened with the network, the way they have been serviced when they get vaccinated. And I think this is there are some bad side to this crisis, but there is a good side, and this is how the Quebecers are getting back the confidence in their health system. So to me, I think this group that is led by Daniel, and I think they've done a tremendous job, vaccinated 3 million doses in the last 3 months. I think this is spectacular. So I think it's, I'm confident. I'm not sure if that's the right word. I think I really think that we can continue to improve, and I will let the Quebecers be the judge, but I think Quebecers are proud of our system.
Just a question for Dr. Arruda. With regards to CEGEPs and the exam periods coming up, is there a plan to allow for virtual exams? Or if that's not the case, has public health given guidelines or some sort of a safety plan if exams will take place in person?
Yes, there is work done with my teams, with the Ministry of Education, trying to find a way to let the things be done and safely. And I would add something for what I said. I would say that it's a happy day today because we are asking people and will vaccinate the population, but we should not forget the ones who haven't had that chance in the first wave and second wave who die because they were not vaccinated. So it's why I think, by respect for them, I also ask people to get vaccinated, because that's really the way we're going to be able to get away from that terrible disease.
Just a little precision. So there is going.
Yes, there is going to be some, and it could be done in different ways probably, but this is still in discussion with education and our teams.
Maintenant, Cathy Sonny, CBC.
There are in certain regions, for example, in some areas in Montreal, where the rate of transmission is higher while the rate of vaccination is lower. And normally that coincides with the fact that more people at-risk populations. So you've got a challenge right there. There have been some mobile clinics here and there, but certainly it's not enough. So what are you thinking about?
Well, maybe I'll start, because as you know, I think I say that a lot, but public health, especially in those regions, and I'm thinking about Dr. Drouin and Dr. Trépanier, have done a tremendous job of being surgical in some of those regions with those mobiles, they call that the clinique éphémère, and we've toured a couple of them to see on the ground what it looks like. And I think they will continue to do that. I think we even see on Google Map now, we can compare the same region, the way it has been, where are the cases, and we have the same region on Google where we have the postal code of the people that have been vaccinated. And we can compare both, and we can be very surgical now and say, oh, there is a hole there. There is some people on those streets have not been vaccinated, and there are some cases there. You see, so this is the technology that now we are able to use to be surgical, as maybe not necessary in less populated areas. So this is the sort of work that is being done right now. And I think with the sort of knowledge that we have developed over the last year, I'm going to touch wood, but this is probably the reason we have the situation, I don't want to say under control, but going at this stage right now.
Okay, but then if you know and you see where people have not been vaccinated, and that you see also that the transmission rate is going up or is very constant. So what do? Do you put in place drive-through vaccine shots, as you spoke?
Mobile vaccination. There is I don't know how to say it in French, but there is a group in Montreal that I visited, Montréal Nord, called Access. And this group, they go and knock on doors. They really go at the door of the people and just said, we just want to make sure that you are aware that there is a vaccination place close to your place, or we'll have this mobile vaccination in 2 days. We suggest you go there. They really go and knock at the doors. So I think this is very niched approach that they do.
And I would like to hear.
Basically, what Mr. Dubé is saying is we have this information, so we know we're not just guessing. So we know exactly what we need to do. We know where we need more, where we have to put more effort, and new clinics, just like you mentioned. And in the next couple of weeks and months, this is our plan to continue to offer different ways, the vaccination, to have the different influencer, different people to promote vaccination.
And the drive-through vaccine service
is one of the examples.
That's a good point, but I would let Horacio, but
Yes.
just on the drive-through, I think this is the reason I like this idea, and we'll talk about it next week, is some families, given the young kids, or they think they can get in the car and just go and be all together. So, but this is another service that we can give them. So that's what we're looking at.
Through shot vaccine.
Yes, exactly.
Concernant donc le service à l'auto, pourquoi ça serait commode?
Why would it be good to have a drive-in offering? Is that okay? Well, if you have anything else to say in English, well, as you wish. I mean, we'll let the president decide how to work. Well, if you will, maybe in English. And then
In fact, there is the way of distributing the vaccine, which will limit some barriers. But before of that, there is, I would say, polls done to understand why those persons are not get vaccinated. There is some who are waiting for see what is going on with the others. They are the late people who will go later. Okay. There was some which is because of different convictions, and with this we work with the communities, and so we are dissecting and we are doing studies to understand why people don't. And there is different approaches, motivational approaches that are done specifically on families and everything. So, and it's true that there is higher places with higher incidence and lower vaccine. But I would say that Dr. Drouin told me that even with their intervention, the rates are almost very interesting, even in those communities, comparing from what we suspect, just because we had those strategies. You know, we have to work with communities, we have to work with leaders in the communities, and all that is important. And there is always people who will wait before getting vaccinated. But we will follow up that, and I think there is always a certain amount that we will never be able to vaccinate. They are really the hard ones, but the other ones are going to follow up and see the impact of getting vaccinated on others.
Le service à l'auto, pour revenir pour les Franco.
so drive-in, if you could say something on that for the French. It would be practical next week to do an update on that. Well, I can't tell you which day because we're finalizing it all, but we will be announcing together with Danielle next week a drive-in vaccination site will be the first one. Without saying everything about it today, the principle that we found very interesting and that was very popular in the United States, you'll recall the images that we saw in the big shopping malls and things like that where there's a lot of parking, because there's logistics to that as well. You know, people get vaccinated and then you have to wait 15 to 20 minutes after. It's very, a lot of logistics to get organized. But the big advantage that we saw is for families. Families don't have to look for a babysitter. They don't have to think, okay, well, what can we do with young adults or people from school? So there's really good formulas that will be very practical for certain families to say, okay, well, in our bubble, there's 4 of us and we're going by car, we're going to get vaccinated, we'll be there all at the same time. So we've asked Danielle to find us a first site, and we'll be announcing that to you next week. And once we'll have that finalized, we'll have a few days of practice because it'll be our first one and we want to do things properly. So next week, we'll see how things go. And I really look forward to announcing that to you next week. And that puts an end to our press conference. Thank you, Mr. Dubé, Mr. Arruda, and Mr. Paré. And start making your appointments.